are back with our coverage of the coronavirus.
Good afternoon,
update.
everyone. Thank you for joining today's update on COVID-19 in North Carolina. As of today, we have 1,721 new cases reported and 906 people in the hospital. And today is the second highest day in both of those categories since the pandemic started. We also have 1,271 people who have died, and we continue to pray for those we've lost and their families. North Carolina has been careful in lifting COVID-19 restrictions, and it's because public health experts warn that removing restrictions too fast or all at once can cause a dangerous spike in the virus that would overwhelm our medical system. That would not only harm people with COVID-19, but also those needing treatment in this pandemic. Dr. Cohen.
Thank you, Governor, and thank you for your ongoing leadership and for the decisive actions that you continue to take to help protect North Carolinians during this pandemic. I'll now walk us through our latest trends. As a reminder, we look at a combination of trends that guide our decision making. They include COVID-like syndromic cases, lab-confirmed cases, positive tests as a percentage of total tests, and hospitalizations. These were chosen based on public health data and White House guidance. And remember, we cannot look at any one of these metrics in isolation. We really need to see them as a whole package when making decisions. And remember, each of these data points has its own limitations. So in our first graph, we look at people who come to the emergency department with what's called COVID-like symptoms. This metric serves as an early warning indication mechanism for us. Looking at the yellow line, you can see there's been an increase in this metric over the past few weeks. This upward trend is concerning. Now, moving on to laboratory confirmed tests. Again, as you look at the yellow line, you'll see that the 7-day average shows that last week started to level, and that's some good news. However, this trend has continued to be elevated through most of our phase 2 opening, and today we saw the second highest number of cases at 1,721. We really want to see this trend stabilize. Now, this next graph shows the exact same data that we were just seeing, the lab-confirmed cases, but now we're zooming in for a closer look. This graph, again, shows data since May 15th and not all the way back to March, so you can see it in more detail. Looking at the yellow line, again, shows that slight leveling in the last week, but today also shows that second highest day of new cases today. Moving on now to the percent of tests that are positive. This metric provides important context to our number of cases. I want to draw your attention to the yellow line, and what you can see is that the percent of total tests that are positive continues to be elevated. Unfortunately, we would like to see those numbers be closer to 5%. This metric helps us understand that our increase in cases is not just due to more testing. It indicates that the virus is still very prevalent in our state. On this next metric is day-over-day hospitalizations. And the yellow line shows that North Carolina's trajectory of hospitalizations is rising, as the governor said. Yesterday was our highest day of hospitalizations with 915 people in the hospital. Now, our hospitals still have capacity to meet increased demands if more people become seriously ill, which is good. But the fact that this metric has continued to climb for more than a month is concerning. We would like to see this at least level or certainly decline. If this upward trend continues or worse, accelerates, we could face capacity challenge within our healthcare system. Okay, so here's where we are. Surveillance data shows an upward trend. That gets a red X. North Carolina's trajectory of lab-confirmed cases is starting to level, but it's still climbing. It gets a red X. North Carolina's trajectory in positive tests returning positive remains elevated, and it's much higher than we would like to see, so this gets a yellow line. North Carolina's trajectory of hospitalizations is rising, though we still have capacity in our healthcare system, so this trend gets a yellow line. As far as our capacities that are critical to allow us to respond to this pandemic, here we continue to see positive trends. Testing has an upward arrow. We're averaging more than 17,000 tests per day now for the past week, and we have more than 500 sites listed on our websites, plus additional testing pop-up sites. However, North Carolina labs and labs around the country are starting to see supply shortages again for laboratory chemicals called reagents, a key component needed to process tests. We need the suppliers and the federal government to work with us to resolve these issues. This is a concern. There are over 1,500 full-time and part-time staff supporting our contact tracing efforts, and our PPE supplies are stable. We have enough critical supplies on hand to fill requests for at least the next 30 days. So these concerning trends remind us that if left unchecked, the virus will continue to spread. But we have the power to get these trends moving back in the right direction. But we need your help. Wearing a face covering in public settings is a simple but powerful action to slow the spread of this virus. The scientific evidence is compelling. However, face coverings only fully work when we all do it. If each person commits to wearing a face covering, we can stabilize our COVID-19 trends. We all have a role to play, and it starts with the 3 W's. If each of us commits to these simple actions, we can fight back against this virus. We can protect our families, our friends, and our neighbors, and get back to the people and the places we love. Thank you, Governor.
We'll be right back with more coverage of the COVID-19 update.
Thank you, Dr. Cohen. The numbers we see are a stark warning, and we must pay attention.